It's important to realize that most people who are exposed to asbestos will never develop any asbestos-related disease. If disease does develop, however, it'll fall into one of two types, either scarring or cancer. With cancer, we can have cancer of the lung, mesothelioma, or cancer of the lining of the lung, or cancer of the throat or digestive tract. With scarring, there are two types. There's scarring of the lining of the lung, or pleura. We call that pleural plaques or pleural disease. And then there's scarring of lung tissue, which we call asbestosis. Perhaps I can best describe asbestosis by drawing you a picture. There are thousands of tiny little air sacs in the lung. Next to each air sac is a blood vessel. Normally, there's a very thin membrane separating the air sac from the bloodstream. Oxygen gets through this thin membrane very easily. However, when you have asbestosis, you get a thickening of the wall of the air sac so that it makes it difficult for oxygen to get through. If enough of these air sacs are scarred, then you'll have shortness of breath. Bear in mind that your chances of getting this disease depend on how long you were exposed and how much dust you breathed in on a daily basis. The greater the exposure, generally speaking, the greater the risk. That's why it's so important to prevent any further exposure.